Hello everyone, I'm Dr. Nanditha, consultant physician practicing at Chiguru Multispecialty Hospital, Bangalore. So today we'll be talking about a topic called as indigestion. So what is indigestion? Indigestion means you'll have that discomfort, a pain in the upper part of your stomach. There'll be bloating or belching, which you see after intake of your meals, or reflux of your food contents following the intake of your food. Okay. So what are the commonest causes which can cause indigestion? Okay, so it can vary from a simple cause to something of severe note. So coming to the simple causes, it is related to your lifestyle changes. So we see that a lot of us have change in the the timing and the type of food consumed, which can on long term lead to symptoms of indigestion. Second thing, something called as gastritis or duodenitis. Okay, it is nothing but inflammation of your stomach or inflammation of your first part of the duodenum or intestine. Okay, so thirdly, it is caused by acid reflux. So we have something called a valve, which is usually seen in the upper part of your stomach. The main function of this valve is to keep the content of your stomach inside the stomach following the intake of your food. So some people, because of lifestyle or some other causes, what they have is they'll have a incompetence of this valve, which can result in reflux of the contents of the food from stomach to the upper part of the food pipe, which can happen after the intake of your meals. Okay, so on a serious note, symptoms of indigestion can occur in patients who have gastric ulcer. Okay, then something called as cholecystitis, nothing but the inflammation of your gallbladder, which can happen because of infection or the stones in your gallbladder. So we see of late there's a lot of rising cases of indigestion in India. So why do we see this trend? It is because of our lifestyle changes, stress, increase in the consumption of alcohol and smoking, and also various other causes. So are there any red flag signs, or is there any signs following which you have to consult your physician or your gastroenterologist? Yes, there are. So the main things are the pain, which is on a continuous note, not subsiding with your regular antacids. Second one, when it is associated with vomiting, jaundice or fever. Third, when you start noticing there is a loss of weight. Fourth one, when you have blood in your vomitus or in your stools. So these are what called as a red flag signs for which it is needed that you consult your physician or your gastroenterologist. Okay, so how can we tackle this? Symptoms of indigestion which can occur because of various causes is, first we'll have to change our lifestyle. So how do we change our lifestyle? A simple note, you can change the timing and the type of food consumed. So how do we change that time? So earlier days we had a fixed timing on which we used to consume our meals. So now we see of late there's a trend of having your breakfast after 12 o'clock, eating very late, your dinner can be around at 12 a.m. or 1 a.m. All of which on long term can cause to symptoms of indigestion. So when you have a fixed meal, so basically you can consume your breakfast at around 9 o'clock or 10 o'clock, meal at 1 to 2 p.m. and preferably it is better to have your dinner at around 7 p.m. to 9 p.m. So try to avoid having your dinner after 9 o'clock or after 10 o'clock. Okay. So second thing is the type of food consumed. So what can we do? Instead of consuming what is called as fast and processed foods, you can have a whole and balanced meal. So what is this whole and balanced meal? It is nothing but consuming high fiber diet, including more of vegetables and fruits in your diet, and having a lean meat and avoiding processed foods. Okay, then you have to, if you are a person who is taking a lot of alcohol and more of smoking, I would advise you to decrease the intake of these two entities. Okay, so then take more of plenty of water. One more thing which we can do to tackle symptoms of indigestion is please walk for 10 to 15 minutes after your each meal, preferably after your dinner, which can help you in long term in controlling your symptoms of indigestion. So, are there any home remedies? Yes, there are a lot of home remedies. So, simple ones includes having ginger in water, having fennel seeds after your intake of your meal, or adding a little bit of lime juice to your water and consuming it after the meals. But better thing would be changing your lifestyle, which can help you on long term in controlling your symptoms of digestion. Okay, that's all for today.